Start करें. Okay. Hello, my dear friends. A very warm welcome to all of you. Gurdat कहना एकदम फाड़ू लग रहे हो sir. Thank you, Gurdat bro. So today we are going to discuss all the questions of INICET which came from 2024 till 2011, and all the topics which has been asked. We need to have a complete command over that topic. And we also need to practice all this question, because I have seen again and again 20-30% question are directly repeated, and around 50-60% question are, at least 50-60 are from the same topic which has already been asked in INICET exam. So let's start with this first question. The Declaration of Oslo by World Medical Association in 1970 is related to which of the following thing? So the first is this guideline for physician to prevent torture. This was the declaration made in Tokyo. So this is Tokyo Declaration. Then International Code of Ethics, Medical Oath. This is Geneva Declaration. Geneva, which also have the headquarter of WHO, Red Cross, International Labour Organization, and USAID. All these four, WHO, Red Cross, ILO, USAID, Health, all these four organizations have headquarters and also at Geneva, and in that declaration this medical oath was done. Medical termination of pregnancy and therapeutic abortion, this is the one which was given in Oslo. And then ethical practice in research and human subject, this was Helsinki Declaration. Helsinki deal with human, Tokyo deal with torture, okay, and termination of pregnancy, abortion is with Oslo, okay, and Geneva is of course the WHO, so medical ethics and all. Then research on human database, biobanks and big data, this was Typhoid declaration was based on this thing. So these are the 5 declarations which you have to remember. One more thing I want to teach about abortion is that under the new MTP Act, abortion till 20 week period of gestation is allowed, but if on the suggestion of one doctor. But if you have to do abortion between 20 to 24 week, then you need 2 doctor suggestion, and based on the group of doctors we can do abortion even after 24 week. But after 24 week, abortion is done only for congenital abnormality. It is written clearly in PARC, so there is no doubt about it that for congenital abnormality it is allowed after 24 week. And between 20 to 24 week, if you are doing abortion, there are 4 type of cases in which we can do abortion between 20 to 24. One is rape, other is incest. Incest means family member did sex and lead to pregnancy, unwanted pregnancy, and then that is there, rape, incest. Then failure of contraceptive, and of course the 4th reason is congenital abnormality, in which you can do it even after 24 week. Now coming on to the next question, this is a new question, so do remember. Similarly, in the last 2-3 exam they are asking the work of organization like Ford work for sanitary latrine and knee high, okay. ऐसे याद कर सकते हो कि फोड़ के हगा है ना, you did this big sit, the sanitary latrine got ruptured, and then after that you have to take bath, knee high है ना, means bath. So sanitary latrine, knee high. Care is most needed in children, so care work for fund ICMR, Indian Council of Medical Research, and Anganwadi work. Rockefeller Foundation is trying to make our foundation rock solid. So Rockefeller Fund Research and Rockefeller Fund National Institute of Virology. Okay, these 2 are funded by Rockefeller. Then of course Red Cross organization, Red Cross give fund for relief, war victim relief, and it also fund disaster management and all. And then after care, Rockefeller and all, they have asked already about Colombo plan, so it's very easy to remember. CO for Colombo, CO fund for cobalt therapy unit, and under this Colombo plan, AIIMS New Delhi was also formed by taking fund from New Zealand by Rajkumari Amrita Kaur, our first health minister, And Colombo Plan also fund agriculture and technological growth. So these are some of the organization which work they ask. Other than this, they can ask, what does USAID fund? USAID fund malaria program. It looks like it will fund HIV, but it fund malaria program. Then UNDP fund sustainable development goal. United Nations fund for population activity fund family planning program or family planning activity. And then of course UNICEF fund maternal and child health, but UNICEF also fund seed and manure of applied nutrition program. Okay, applied nutrition program, seed manure. So these are some of the question already being asked. Do revise it before going to the exam. Next question in 2024 May INICET was this: which of the following is immediate life-threatening situation? Of course, I hope you all know the answer. That is red. But if they ask which one is relatively stable, that will be yellow. Yellow is relatively stable as compared to red. Red are usually those who need life-saving surgery within 6 hours, and yellow are those who need surgery between 6 to 24 hours usually. Then of course there is green, which is ambulatory, and ambulatory are not relatively stable. Ambulatory are completely stable patient. They just need some dressing, stitches, cast, and they are ambulatory because they can be moved from one place to another on wheelchair or stretcher and all. And of course black is for moribund or dead patient. And I hope I know you know that if there is a war going on, in case of war we do reverse triage, and in case of reverse triage the first priority goes to green. After green there is yellow, and then after yellow there is red, and then of course black get the least priority. So do remember triage. This is one area where they ask question again and again. Now, which anti-leprosy drug can cause hyperpigmentation? Answer is clofazimine. That's why clofazimine was initially not given in paucibacillary case, because clofazimine not only lead to hyperpigmentation but can also lead to opacification of lens. This too is the problem with clofazimine, so initially we were avoiding it. Opacification and hyperpigmentation. Of course, rifampicin lead to orange discoloration of urine, but it has no discoloration effect on the skin. Chalo. Now, which of the following is associated with sexual dysfunction? Sexual dysfunction is zinc. Similar question from zinc deficiency came in NEET, where they ask if there is dryness around nose and mouth. What is the thing? That is definitely zinc. Then they can ask which of this vitamin can lead to premature delivery, hypogonadism, and a poor wound healing. All these things are with zinc. Poor wound healing, hypogonadism. So this question they have asked again and again, and I hope you all know zinc deficiency also lead to acrodermatitis enteropathica. Okay. Other than that, in sexual dysfunction, we also vitamin E can also be responsible for that. Now, next question is that there is a farmer with high grade fever, rash, vomiting, retroorbital pain. So retroorbital pain with frontal headache, characteristic of dengue, and he came at 5 days with dengue hemorrhagic fever. Which of the following investigation can be done? So NS1 antigen is done up to 5 days, and NS1 antigen detect antigen presence of dengue virus. So this dengue virus presence get diluted after 3 days. NS1 antigen can come negative even if the patient have dengue. So it is up to 5 days. If it is 5th day, the better answer will be anti-dengue IgM by ELISA, because by 5 days antigen concentration will become low and our immune system antibody will be more active, so we will be detecting it by IgM. RT-PCR and DNA is for serotype, because I hope you all know there are 4 serotype of dengue virus in the vaccine Dengavirix, and with DNA RT-PCR we are trying to ascertain which serotype of dengue virus is there. So it is not used for the disease diagnosis as such. IgM after 5 days till 4-5 days it is NS1 antigen. This next question was, which is best test used for malaria parasite species detection? The question may look confusing, but you can see there is 2 smear thick and thin given. So if such two options are there, most probably the answer lies there. And we all know that thick smear detect presence of Plasmodium, because in thick smear we will take one drop of blood and then roll the above one at a gap. So it will have more amount of blood, it will capture more species, it is more sensitive. And because it is more sensitive, it is detecting whether Plasmodium present or absent, that's all. But when it comes to species detection, for species detection we use thin smear, because in thin smear we roll the above slide very closely to the below slide, and therefore we can appreciate the fine detail of the gametocyte. And I hope you all know this two thing, that if you are given a peripheral smear exam photo image based question, and in the peripheral smear if you found dots in it, granulated RBC, then this is vivax. But if you found banana shaped nucleus in it without granules, then it is falciparum. Okay, so this type of thing, banana shaped, can be outside also, this is falciparum, but granulated is vivax. And I hope you all know that to make the smear we have MPW who visit every house in the village once in 14 night and ask for hidden case of malaria. Therefore MPW is doing active surveillance to make this smear. They make it by doing active surveillance, the sub-center worker MPW is doing it, but malaria slide examination is done at PHC, okay, not at sub-center. So do remember this other question related to it. Now, which of the following is seen in some dehydration? It is a multiple choice question. If the patient have thirst, delayed skin pinch, decreased urine output, these all can be seen in some dehydration. But this delayed skin pinch is when we do it on the abdominal skin. If the skin retract within 2 seconds, it's normal. If it take more than 2 seconds, it is delayed. But if it is taking a lot prolonged time, then it can also indicate severe dehydration. Sunken eyes indicate severe dehydration. Lethargy also indicate severe dehydration, but a better answer will be sunken eyes. It will take more time to have sunken eyes, and some lethargy can be there in some dehydration. But if the child is non-responsive, it is definitely indicating severe dehydration. It's a topic of pedia, but do go through dehydration and pneumonia classification. It's something which is very frequently asked. Now, a 5-year-old boy visit OPD with general weakness and has following anthropometric finding. The weight for age is -3.2 Z or -3 Z. Now, I hope you all know weight for age indicate both acute and chronic, or acute or chronic malnutrition. Are you getting it or not? Suppose I am a malnourished child. So there can be two reasons of my malnutrition. One reason is that I am not eating well since childhood. That is chronic reason. Second reason is that since last 1 week I am having diarrhea, or 1 month I am having diarrhea. That is acute reason. So they can be together. I am not eating well plus I am having diarrhea, or any one of them. That's why we call weight for age indicate acute and or chronic malnutrition. Why we call it and or chronic? Because it can be any one or both of it. And or chronic malnutrition is weight for age, and it is -3. So it means according to this weight for age, the child is having definitely having this malnutrition, and -3 means severe malnutrition. Now, height for age, I hope you all know height for age indicate chronic malnutrition. This is stunting. So this child is having more than -2.5. So till -2 standard deviation, child is normal. If it is less than -2, it means there is some malnutrition. The child will lie in mild to moderate. I hope you all know this, the definitions part also, because they ask again and again from image-based question also. This above line is for 50 percentile of weight of boys. This second line is at -2 standard deviation or -2 Z score, but this second line also correspond to 3rd percentile of weight of girls, because below -2, 2.5% people lie. So 2.5 means roughly third percentile. And if any child is in it, it means it is normal following road to health. This part is road to health. But if it is between -2 to -3, we call it moderate malnutrition, mild to moderate, or better we call it moderate malnutrition. If it is below -3, then we call it severe malnutrition. So in case of weight for age, child is having severe malnutrition. In case of height for age, child is having moderate malnutrition. Now the third was weight for height. Weight for height is -1.77. -1.77 means according to weight for height, this child is in normal part. And what does weight for height indicate? Weight for height indicate acute malnutrition. So in this child, acute malnutrition is absent, because according to weight for height, he is between 50 percentile to -2. He is normal. So acute malnutrition is not there. If acute is not there, even if weight for age is less than -3, both acute and chronic can be reason for low weight for age, but acute is ruled out. So what is left? Chronic. Plus, according to height for age also, he is having chronic. So according to first and second criteria, both of it are indicating that the child is having chronic malnutrition. आप समझ पा रहे हो कि नहीं? देखो, वेट फॉर एज एक्यूट भी बता रहा है, क्रॉनिक भी बता रहा है. वेट फॉर हाइट एक्यूट बताता है. वेट फॉर हाइट अगर कम है, इट मींस वेस्टिंग. So weight for height is telling us wasting, which is not there in the child. Acute malnutrition is absent. So if acute is ruled out, only thing which is left is chronic malnutrition, and that is what height for age and weight for age both are suggesting, that child might be having chronic malnutrition. And therefore correct answer is only chronic, because acute is ruled out by option 3. Severe acute is also ruled out. I hope you all know the definition of SAM. They keep asking again and again. For severe acute malnutrition, the 3 definition is weight for height should be less than 3 standard deviation or -3 Z score. Weight for height less than -3 standard deviation or -3 Z score. Then mid-arm circumference should be less than 11.5 centimeter. And there should be visible wasting or edema. If these 3 criteria is being fulfilled, then it is, we call it severe acute malnutrition. And do remember this cutoffs and all. PSM plus Pedia both ask question from this part. This is a very important question. I hope you will remember it. Yes, very good. Dr. Rahul Kumar Sinha was correct in answering it. Chronic malnutrition. Dr. Saab is asking, sir, this for NEET PG. Yes, my dear friend, this is for NEET PG and FMG. Both INICET student can also go through it, but INICET exam is going to take place in November. So whatever question come in INICET or NEET or FMG become important for all the 3 exam, because they keep exchanging their topics and question. So it is important for NEET as well as INICET as well as FMG exam. All 3 should go through this. Now, next is, which of the following is not a polysaccharide vaccine? So pneumococcal, meningococcal are definitely polysaccharide vaccine along with VI polysaccharide. Plus some strain of Haemophilus influenza can also be polysaccharide vaccine. But I hope you all know hepatitis B is something which is a recombinant vaccine. And in this recombinant vaccine, we are using HBsAg, surface antigen. SAG, which has been asked again in NEET and INICET, both they have asked HBsAg. So see, whatever they ask in INICET, they ask in NEET. Whatever they ask in NEET, they ask in FMG, and reverse is also correct. One time in FMG, they ask what is estimated average requirement and RDA. So EAR is the estimated average requirement, fulfill need of 50% population. RDA fulfill need of 97.5% population. This question they first asked in FMG, then it came in NEET. So all the 3 exam are interrelated. That's why whatever exam you are going to give, do solve 4-5 year PYQ of all the relevant exam. Okay, so it's a recombinant vaccine with HBsAg and DNA as genetic material. Okay, that is for hepatitis B. That's why it's not a polysaccharide vaccine. So they are asking 2 questions in recent NEET exam from the classification of vaccine. So it will be an important topic in upcoming FMG and NEET also. Let's go through all the vaccine classification once. Which of the following statement is incorrect for rotavirus? You may not know about other thing, but you for sure know that rotavirus is a live vaccine. It's not a subunit vaccine. Subunit vaccines means mostly protein vaccine or protein subunit vaccine. And when it comes to protein subunit vaccine, very easy to remember, P for protein, P for pertussis. Then there is anthrax. And then there is one corona vaccine, which is also protein vaccine, Novavax. Okay, Novavax. So these 3 are protein, but mostly they ask about pertussis is protein subunit vaccine. And of course, rotavirus is given by oral route, not recommended after 6 months. This is also correct. In PARC, they have written that first dose of rotavirus should be given by 15 week, and second dose of rotavirus should be given by 24 week. So if someone is coming after 6 months, then we will not give rotavirus vaccine. Second dose is given till 24 week only, and first dose till 15 week. Now, you also should know that there are 4 vaccine: BCG, pentavalent, FIPV, which is fractioned IPV, not fucked IPV, and then Rota. These 4 vaccine are the one which are not given after 1 year. So if someone come after 1 year, we will not give these 4, we will give the remaining one. Now, when it comes to the classification of vaccine, it's very important and easy to remember that there are 11 live vaccine. Okay, in this 11 live vaccines, 5 are those which are both live and killed. What are those 5 vaccine? We can remember it by the mnemonic CP, Pe, IJO. Come to CP. C stand for cholera, P for polio, P for plague, I for influenza, and J for Japanese encephalitis. These are both live and killed. Okay. Other than this, we have BCG as the 6th vaccine, BCG. Then we have MMR, yellow fever vaccine, which is live but still can be given in pregnancy, and once given it will give lifelong immunity. Then after this there is TB, typhoid, and V for varicella. Varicella have which strain? Okka strain. It was like that song. Savila vila, savila vila. It's time to Africa, Wakka Wakka. Hey, oh, that's the strain. Varicella, Okka strain. And this typhoid is given on day 1, 3, and 5. आज, परसों और फिर नर्सों के बाद 1, 3, 5, 3 dose we give. So how many is done? BCG, MMR, yellow 3, then typhoid, varicella. Okay, and of course the rotavirus. So total there are 11 live vaccine. Why you should remember it? Because sometimes they create a clinical question that there is a nephrotic syndrome child on steroid, which vaccine we cannot give. So we cannot give any live vaccine to immunocompromised child or in pregnancy or in HIV patient. These 11 live vaccine has to be contraindicated, not given, except for yellow fever, which can be given to pregnancy. When it comes to killed vaccine, there are total 7 vaccine which are killed. But see, it is so easy to remember. 5 are CP, Pe, IJO, cholera, plague, polio, influenza, JE. And then you just have to remember 2, rabies and hepatitis A, which 2 you remember, killed vaccine done. Okay, then protein we already discussed, polysaccharide we already discussed, meningococcal, pneumococcal, typhoid polysaccharide, Haemophilus influenza type B. And recombinant we already discussed, hepatitis B vaccine, which we have HBsAg. Last we can read is about killed vaccine. We also read one more is the toxoid. Toxoid are only 2 which has been asked in INICET already, diphtheria and tetanus. Only 2 are toxoid. Okay, so do remember this classification. Now let's go back to the question. Of course, incorrect for rotavirus. It's a subunit vaccine. That's incorrect. Rotavirus is the live attenuated virus vaccine. Now coming to the question of 2023 INICET exams, which of the following is not correctly matched? So observational study is collected, and if we want to search any observational study, MOOS is one way in which we are doing meta-analysis of observational study. I hope you all understand what is meta-analysis. Let's say you must have heard that in honeymoon they give kesar or turmeric flavored milk, and thinking that the person who will take it, they will perform better. So let's say there is a scientific guy who thinks that if I will drink milk, all the blood supply will go to stomach. So how will I perform? And he wants to know whether actually drinking milk improves performance or not. So he will type it on Google that tell me study done on milk associated with sexual performance. So when he will search it online, there will be 4 studies, let's say, which will come on this topic. And I know it because I have done the search. So when the 4 study will come out, he will combine the data and theoretical result both of all the 4 study, and then we will call it meta-analysis. So what is meta-analysis? It is analysis of analysis. 4 study already one time analysis has been done. Now we are doing analysis second time. So in meta-analysis, we collect data plus result both. But what is Prisma? Prisma is for systematic review. All the systematic review are collected under Prisma and are evaluated whether they are of good quality or not by Prisma guidelines. So Prisma is for systematic review. Remember, in Prisma, we do not combine data. We only combine theoretical result. Don't combine data. If you combine data plus theoretical result, it will become meta-analysis. If you combine only theoretical result, it will be the systematic review. Diagnostic study is not consort. Consort is RT stand for randomized trial. And this is the guidelines, and this is the way to evaluate randomized trial. So consort is for RCTs. Okay, and case report is here because if you see CA for case, RE for report. Case report means case study. If you found any one extraordinary patient, let's say you are working in surgery and you find a patient with penile fracture, and you did the whole ask the history, did examination, gave treatment, write the prognosis, and then ask him to go slow and let him go. So this all story of hospital of one patient will be reported under case report. So case report is one patient hospital story. But let's say you became famous and now you are repairing 4 cases of penile fracture in Delhi, 3 cases in Dubai, Al Habibi, and you are writing all this data of 2 group of patient having same illness, then we call it case series. So one patient case report or case study, one or more than one group of patient having common illness and their hospital story, if you will write, that will be case series. So correct, which is not correct, diagnostic study consort, this is not correct. See, strobe is collection of observational study. Observational study is strobe. And for this diagnostic study, we do STARD. STARD is for diagnostic study. STARD. Okay, diagnostic study, whether done properly or not, is under STARD. Then we have SQUIRE, not squirrel, SQUIRE. This is for quality improvement. Let's say you want to know that under Laksh program, we have the work of improvement of labor room, improvement of maternity ward and delivery rooms. So whether the quality improvement has been done or not, this type of comparison is done by SQUIRE. SQUIRE. And SRQR is for qualitative data. Let's say you want to do a research to know whether mother who are delivering in government hospital are satisfied with the services or not. So those qualitative data, qualitative means no categorical, and happy, not happy, these are category. We cannot measure it, we can just classify it. So if you are comparing the qualitative data, then study is SRQR. Okay, so that is there, do remember it. Square is quality improvement, SRQR is qualitative data, START is diagnostic study. This is one topic which we ignore, but being asked 2 times already in INICET, so very likely to come in NEET and FMG exams. Next question is about kappa statistics. See, kappa statistics is to know that if 2 people are, let's say, seeing 100 X-ray, some are saying this X-ray is of TB, some are saying no, this is not of TB. This is just showing some calcification or silicosis. So these 2 doctor, how much they agree, and their agreement, is it due to chance or do they really agree? This we decide by kappa statistics. So kappa statistics is for which purpose? The purpose of kappa statistics is to know inter-observer agreement, that how much 2 researcher agree on anything. And to get that data for kappa statistics, what we do is we first calculate the random agreement, agreement by chance, and we subtract it from agreement which is observed, and then in the denominator we divide it by 1 by agreement with chance. So how much is agreement observed, that you have to calculate, because agreement by chance usually come out 0.5. We can also have the formula to decide that. I can teach it, but in objective exams they don't give this much of time to calculate the experimental or this by chance agreement, which is usually come 0.5. Now how do you calculate observe agreement? See, in this case both IGRA and Mantux are agreeing on 80, and both IGRA and Montux are disagreeing on this 60. This table is a bit, this is just telling you total. This is the table, 2 by 2 table. So 80 and 60, true positive and true negative, are the place where they agree. So this 80 and 60 is the observed agreement. And out of how many people this 80 plus 60 are observed, there are total 200 reports which are coming out. So 80 plus 60 is out of 200. If you solve it, it will come 140 by 200. 140 by 200, it means 70 by 100. 70 by 100 means 0.7. So observe agreement is 0.7. Agreement by chance is 0.5. And divided it by 1 minus agreement by chance 0.5. So how much will come? 0.7 minus 0.5 will be 0.2. And 1 minus 0.5 will be 0.5. So it will be 2 by 5. We can also call it as 4 by 10. So final result will come 0.4. So in these cases, you only have to do is to find the observed agreement, and then you can do it. But only one time the calculation has came, and less likely to come. But still, what we should know is what is the classification. If it is came 0.4, what does this 0.4 mean? What does this 0.4 means? So see, if kappa statistics is 0 to 0.2, then there is almost no agreement. And this is, the agreement is very less. If kappa statistics is 0.21 to 0.4, we call it fair agreement, good agreement. If kappa statistics is between 0.6 to 0.8, we call it like good enough agreement. Okay. And if it is 0.8 to 1, we call it perfect agreement. And this is substantial agreement. And if it is 0.8 to 1, we call it perfect agreement. So no, then fair, then substantial, and perfect agreement are the classification on which they have asked one more time the question. So do remember this, the classification also. Now let's come to this question on snake bite. Do it right, which we don't do. What is the except what we do? So mostly the confusion is when we write the full form of right, R is for reassurance, and we think I is for incision, or well, we don't know I. I is for immobilization. Immobilization. Don't let the patient walk, because if he will walk, he or she will walk, the venom can spread more readily. So immobilization is I. Then what is G? G stand for go to hospital. What is H? G and H both are go to hospital. And T stand for tell sequence of event in detail after the bite. what has happened, where the bite has happened. After the bite, are you feeling drowsy, or you know, what is the situation of the local area where the bite has occurred and all. So which is not done, incision is not done. And in some movies you have seen that actress or actor also, they suck the blood and then spit it out. So don't suck the blood also, that is also not in the guideline. And don't put tourniquet, and some places they say that put tourniquet. So incision, tourniquet or sucking of blood, all are not allowed. Okay, this is not in the guideline. Okay, so this is there. Very good. Now let's move ahead and discuss about this question of high fat intake diet according to FDA. What is this high fat intake diet? So Nikhil, do you have my phone? I will show you the difference between high fat and low fat intake diet. Okay, मेरा phone है क्या यार? देना यार. So high fat diet is something which has about 1000 kilocalorie energy, but only 50% is from fat, not 80%. So this part is wrong. Okay, and because 50% is from fat, and out of 1000, 50% are from fat, so that means how much kilocalorie is from fat? Around 400 to 500 kilocalorie is from fat, not 1000 kilocalorie from fat. And if 500 are from fat only, we cannot have 400 from carbohydrate. So high fat diet intake does have this 1000 kilocalorie, but 50% is from fat. If it is low fat diet, भाई वॉशरूम में था, मैंने गलत डिस्टर्ब कर दिया भाई को, सॉरी भाई. If it is, sorry yaar, it was just there. So if it is low fat diet have only 25% fat. Okay, high fat diet has more fat. Now let me show you the actual image of this diet, so that you can know the fine details of the diet also, how it is there. Yes, it's there. See. Just 1 second. And do remember the fine details as well. Sometimes they ask question by creating this multiple choice option like here. So you should be ready for that. Yeah, Golubai, come. Golubai, send it one more time. Come. Oh, it's some party picture out on the background. Hey, why it is not coming, bro? Okay, I will show you that high fat diet thing in detail. But do remember, if it is low fat diet, it is 25%, and in high fat, it is the calorie is 1000, out of which 50% is only fat. So 500 kilocalorie is from fat. Remaining 20-30% is from protein, and 30% is from carbohydrate. So carbohydrate will not be 400. Carbohydrate will be around 200 to 300 maximum. Okay. Chalo. Now let's go back and do some more question. Then I will show you that thing after the break maybe. Let's say this question they asked, that a child came for DPT vaccination at 10 weeks. He has a history of fever of more than 40 degrees Celsius and inconsolable cry at 6 weeks when he took it for the first time. Do remember this one point, that all side effect of DPT or pentavalent, what are the side effects? There are 3 side effects. One is convulsions, abnormal movement. Other is this unconsolable cry, and third is this fever. All these 3 side effect is due to pertussis component. It has nothing to do with diphtheria, tetanus. Only pertussis component cause the side effects. So if on previous history you saw the side effect, will you continue giving it again? No. But when DT is not causing the problem, we can give DT vaccine. Okay? Because the problem is due to pertussis. So just remove the pertussis component and give the remaining one. Okay? All the teacher is teaching the same thing, but one good app has given the wrong answer to continue giving DPT. But we should not give DPT because pertussis is causing the problem. Next visit, we can give the DT. So do remember, this is something which is from the Park textbook directly, that pertussis is causing problem. So we will give DT. Okay, next time. Now, next question is that a person has a dog bite. Vaccination is up to date for both the dog and the man. Personal history is significant for having undergone splenectomy 5 years ago. What is the best management in this case? So if the patient has undergone splenectomy and one antibiotic is being asked, then the antibiotic of choice will be amoxiclav. Okay, we will give the antibiotic amoxiclav here. Now, this is a good question. 30,000 women were followed up to 10 years for the development of breast cancer. Then 1,200 women developed breast cancer and were given a questionnaire to assess possible risk factor. Additionally, 2,000 women from the same study were used as control and were also given the questionnaire. So what is happening here? Two things is happening. One thing is they are being followed up. So whenever we do the follow up, then follow up means cross-sectional cannot be, case control cannot be there, cross-sectional cannot be there. Because I hope you all know, in case control, we only go in past. That's why case control is retrospective study or case control is backward study, because we only go in past. And if it is cross-sectional has only to deal with present. We do not do follow-up or go in past, only present. So case control, cross-sectional, both are ruled out. Now, apart from following up, they are also doing one thing. They are, with the questionnaire, they are collecting the data of the past. So they are doing follow-up and they are also collecting data of past. So that means we are doing both the thing. We are doing cohort as well as we are doing the past data collection, case control collection. This kind of study is known as nested case control or mixed cohort or ambispecative cohort. All these three things are different name but same study. So the mnemonic to remember all these three is MAN. MAN. How? M for mixed cohort, A for ambispecative, N for nested case control. And why they are calling it case control, nested case control? Because the main difficult work is doing the cohort. And in the cohort, data of past collected by questionnaire is inserted. तो कोहॉर्ट में केस कंट्रोल ने घोंसला बना लिया है ना? क्या बना लिया? घोंसला, है ना? Data of past case control is inserted, nested in cohort. That's why we call it nested case control. If you found these two lines written, which two lines written? Past data, past written data by questionnaire or by work data, plus future follow-up. If you found both of it, then it is definitely MAN. Mixed, ambispecative or nested case control. But if you find only past written data, no future follow-up, only past written data, then it will become retrospective cohort. It's not retrospective study. It's retrospective cohort or historical cohort. So how you can remember these two together? By the mnemonic RH. RH is only past written data, retrospective and historical. And MAN is, MAN can go both sides. So it is mixed, ambispecative or nested case control. How retrospective cohort is different from case control? In case control, we take personal history only. And the two group are one group with disease, one group without disease. Only personal history is taken. But if you found written record data, it become retrospective cohort. If you took personal history, it become case control. And here we are taking questionnaire, so we are taking the personal history in a way, but we are using that written record along with future follow-up. That's why it become mixed, ambispecative or nested case control. Okay, so whenever you find both, it is MAN. Only past written record, it is retrospective, historical. Do remember, this is a very common area of question these days. Now, in Kaplan-Meier survival curve, the band used for confidence interval is, see, if let's say your Kamina rascal relative or some rascal neighbor came to your house and asks that whether angioplasty is better or stent is better. And suppose you don't know the answer. So you can call it to your rascal relative is ki, after looking at your face, I feel like pissing. So let me go to the washroom and I will come back and tell you the answer. And then in the washroom, go and type this thing, Kaplan-Meier survival plot between two things. Let's say the two things are, one is stent and other is, let's say it is angioplasty. Okay. In Kaplan-Meier plot, suppose 140 patient go through stent and 140 patient also go through bypass grafting. And we are writing the year of survival, 2 year, 4 year, 6 year, 8 year, like that. So you can see at 5-year time, the survival by bypass is only 30, but the survival by stent can be 50. So according to Kaplan-Meier plot, you can say that stent is better. Although the data can be misleading, but with this we can say which intervention have better survival. And why that neighbor was rascal? Because he had already asked it from the doctor. He's not asking you to know the answer. He's asking it to you so that he can compare whether you know it or not. So this is the one thing which can help us to compare two intervention. But can we be exactly sure that at 5-year only 30 patient will survive by bypass? No. If the patient is doing, let's say, exercise, taking good care of health and diet, then the survival chance can be more than 30. Therefore, the answer never come in one precise sort. The answer is always in a range, because we are never sure whether 30% survival is there or 40%, and it all depends on person to person compliance to the suggestions and all. So the answer never come precise, answer always come in a range, and this range is known as confidence band. This range is confidence band in which answer come. Now confidence band is of 3 types. One is Hall and Wellner band, other is equal precision band. Equal precision band. Okay, then there is log EP band also, log equal precision band also. So that means out of this, which is the confidence band? Hall and Wellner, because option 1 is unequal precision, not equal precision. So Hall and Wellner equal precision band can be used. And do remember, this type of plot suggests us which one has better survival. The one which is more on this side, this one will have better survival. Like here, stent is better survival. Okay. And a question in recent INICET came also from this Kaplan-Meier plot, in which there were 3 plots. One plot is that to prevent organ transplantation failure, when they silence the CD4 indicator, this plot came. When they did not let CD8 marker work, then this was the survival. When they does not let CD4 marker work, this was the survival. And this is the patient number, this is years of survival. And when they did not let both CD4, CD8 work, CD4 plus CD8, both were inactivated in the patient, then the immunity will be much lesser and organ rejection will be much lesser, so survival will be better. So the question was, what is this Kaplan-Meier plot is suggesting? This Kaplan-Meier plot is suggesting that CD4 and CD8, if both are being inactivated or silenced, then this CD4 and CD8 together will have better survival. So the better survival is the one which is going more towards the right hand side, which has, because here we are writing years of survival, so this will have more years of survival, the more right hand side. Okay, so this is Kaplan-Meier plot. 4 questions has already been asked from this area, so very important to remember. Which of the following may be used to find normalcy of data except? So when we plot histogram, it can tell normalcy. Mental Hensel test is to compare matched categorical data. What is matched categorical data? Let's say you found a new drug to decrease anxiety of students going before exam, and they take your drug and they will be cool and relax. and they will not be sleepy also. So if you found such a drug and you want to know whether your drug is better than the fluoxetine or not, then you can give it to a group of students who are 25 year and going to give exam your new drug, and the same 25-year student will get the older fluoxetine. So this type of data, both new drug and old drug fluoxetine are given to same 25-year male going to give the exam. This type of data is matched. Matched means similar, not exactly similar, but at least they are similar in their age and similar that they are going to give the exam. So if you are comparing this type of match data, and why this is categorical data? Because we are asking, are you relaxed or not? And you are asking, are you happy with your performance or not? So relaxation, no relaxation, happiness, no happiness, this type of data is categorical. So whenever you are comparing match categorical data, then we use mental Hengel test. So this is not used for normalcy, but box whisker, Shapiro-Wilk test, and plot histogram all are used for normalcy. I hope you all know, must be knowing about box and whisker plot. This box and whisker plot looks like this. It has in the center usually 50 percentile, then 25% and 75% are here. And these are the outliers. The extreme value is known as outliers. So there is two roles of box and whisker plot. Box and whisker plot are used to do the Q test and to detect outlier. What is outlier? Outlier are extreme value. Like in UK, they do a survey every 2-3 years that how many sexual partner you have in your life, and usual answer come 2 to 9. But in the same UK population, some hunter, they gave the data, I had 699 sexual partner, 584, 399. So will you include those hunter data in normal data? Of course not. Otherwise, the mean of normal data will become very high. So they are the outliers. We can identify the outlier by box and whisker plot, and we can remove them. So this is the use of box and whisker plot. Do remember it. Okay, dear. Now, this formula given here is corresponding to which of the following? Do remember, if you have the square here, this is a standard deviation. If you don't have the square, then it becomes variance. Variance, no square. No. Variance will also have a square. Really sorry. If you have this under root correspond to standard deviation. No under root, then it will become variance. Because I hope no standard deviation is under root of variance. I should have asked it from you rather than answering it again and again quickly. There is a question which Arnav Raj Parikh is asking, Sir, FMGE ka kab hoga? In next 4-5 days, I will also do FMGE PSM recall. But my dear friend, in FMG, real language of recall usually never comes because there are exam in 2 sessions. After 1 session, there is a break of 1.5 hours in which we are not in mood to recall. After 2nd session, the whole day of work, we will party, and who can recall after party? So if you are doing FMG questions, you can only know the topic from there. But if you are doing NEET INICET, you can get a better recall. Plus, so that's why we must do INICET and NEET also, NEET for 6 years and INICET for 2-3 years before giving any FMG exam also. That's why this recall is also for FMG student and NEET student. Don't take it only for INICET. Very important recall are this. Plus, we will cover a lot of question, and which will many of them will come directly also. Okay. So this is useful for all. Mean and median, of course, I hope you all know mean is the average. We use mean for quantitative data. Quantitative are measurable data like cholesterol, bilirubin, BP, HB. These are quantitative. And median and mode. Do remember this thing. Median and mode. These two are used for qualitative data. And qualitative is same as categorical. And like if I say my obesity, is it quantity or quality? And you can only categorize my obesity ki mote tu thoda mota hai, bahut mota hai ya phatega, hai na? Mild, moderate, severe. But you cannot say that I am 2.9 obese. You cannot measure it. So categorical will be obesity. Categorical will be obesity, but what is measurable? Quantitative. Quantitative will be my weight. So whenever it is categorical, qualitative, we use the chi-square test. Do remember this point. We will discuss it in next question also. When it is qualitative or categorical data, Data comes in median mode and we apply which test? Chi-square test. But in case of quantitative, we can apply paired, unpaired, ANOVA, all three. So let me ask you this question from all of you. Which type of example is hypertension? Hypertension is quantitative or qualitative? Do reply it, my friend. I'm not asking question from it, but I will ask it. What is the hypertension, where the hypertension will go? Quantitative or qualitative? Where will you put bilirubin? Where will you put cholesterol? This was the question in FMG exam, just one exam back. Where will you put the cholesterol? So, hypertension cannot be measured. Hypertension is only mild, moderate, severe. Hypertension will be qualitative. BP will be measurable. So, quantitative will be BP, weight, BP. And now we cannot measure hypertension, it's just category. Now, what is bilirubin and cholesterol? Let's talk about cholesterol. How is cholesterol? Whatever you can measure is quantitative. What you can only classify is qualitative. So, what is cholesterol? Qualitative or quantitative? Do tell. Bilirubin quantitative. Kansika K has said. Gaurav Dhamija has said. Both of them has said. Bilirubin, cholesterol, these both are quantitative because we can measure it just like BP. Now, last question from all of you. Let's see whether this concept is clear to you or not. Where will you put anemia? Is it quantitative or qualitative? Anemia. So, where is anemia? Bilirubin quantitative, correct. Where will you put anemia? Quantitative, qualitative? Just do let me know. And Gurudat Singh has also one more question about NSSK or Dutch. We will discuss that also. But do tell me this answer. Anemia is quality. Mild, moderate, severe anemia, these are category. We cannot measure anemia. What we can measure is HB. So HB is quantitative. All disease, whatever disease we are writing is qualitative. So do remember, in exam, if they give question on hypertension, anemia, obesity, any disease, and the data is in percentage or proportion, then which test we apply? We apply chi-square test. If we are talking about any disease or percentage of obesity, percentage of anemic student in the class, then the answer will be chi-square test. Now, if they are asking question on bilirubin, cholesterol, HB, C-reactive protein and all, this means the data is quantitative. And if the data is quantitative, we just have to ask three simple questions. First question, in the question, have you found pre, post, before, after, or match word written or not? If this three word is being written, we will apply paired t-test. And paired t-test is same as dependent t-test. So paired or dependent t-test will only be the answer if these three words you will find in the exam question. If there is two group and data is quantitative, we will apply unpaired t-test, and unpaired t-test is same as independent t-test or student t-test. Same thing, three name. And if there is three or more than three group, then we will apply ANOVA. And full form of ANOVA, sometime they write in the exam, is analysis of variance. Okay. So in this way, we can simply decide which test to apply. Like if they write the question that BP, BP chodo. Let's talk about anxiety. Anxiety of three group of students are measured after giving exam, how much anxiety they have. And based on anxiety scale. Okay. So which test you will use to compare the anxiety? After giving NEET exam, their anxiety is measured. After giving FNG, their anxiety is measured. And after giving INICET, their anxiety is measured. So anxiety of three group of students are compared. Which test you will apply? Now, anxiety is which thing? Can we measure anxiety? We can categorize some anxiety and a mild anxiety, moderate anxiety, severe anxiety. And there are anxiety scale based on which we can decide the level of anxiety in different category. So anxiety, just like any other disease, is qualitative data. So if you are measuring anxiety of three group answer will be chi-square test. But if I say serotonin level of 3 group of students are compared, so serotonin level you can measure. If there is 3 group serotonin level, answer will become ANOVA. 2 group serotonin level, answer will be unpaired t-test. And if they say serotonin level before going exam and after going exam is being compared, then it will become paired t-test. Okay, so I hope this part is clear to you. How to apply, which test to apply, we will do more question on it. It has been asked again and again in NEET, FMG, INICET, all exam. One question which Dr. Gurudat was asking, the difference between NSSK and Dakshta. Dakshta is a Hindi word which means highly skilled. And this Dakshta come under Suman program. Suman stands for Surakshit Matritva Aswasan, Protected Motherhood Assurance. All is well. That is Suman. And I hope you all know Suman work for this thing, zero denial to maternal facility in government hospital. And zero denial to maternal facility in government hospital. That is the main motive of Suman. They forget to write if available, but they write zero denial. And in Suman there are 5 programs. What are those? JSY, JSSY, PMSMA, Pradhan Mantri Surakshit Matritva Abhiyan, and then then Dakshta and Laksh. These are the 5 programs under Suman. And let me write it down. Suman, what are the 5? JSY, JSSY, PMSMA, and Laksh. And 5th is this Dakshta. Under Dakshta, we are focusing on decreasing maternal death. So Dakshta anyway mean highly skilled. What we are doing in Dakshta, we are giving training. Only one thing, training. Training to doctor and nurses. Purpose is to decrease maternal death and delivery complication. Now, they have asked this question in FMG exam, that which of the following is not a priority of NSSK? Option 1, NSSK do not focus in NSSK don't focus. This was the question. Let me see whether you have done your PYQ well or not. Don't focus on which of the following? One is prevention of hypothermia. Other is prevention of infection. Third is free investigation of neonate. Neonate means less than 28 days. Option D, neonatal resuscitation. So this was a PYQ. Do try to reply it. NSSK do not focus on which of the following? Does it not focus on hypothermia prevention or infection prevention or free investigation or neonatal resuscitation? What is your answer? Dr. Kansika K and Gurudat rapidly gave the answer C. Both of you were right. Free investigation of neonate or infant, it comes under Janani Sishu Suraksha Karikram, JSSK or JSSY, which give 3 free things: free ambulance, free food, free investigation. But what are the 4 things under NSSK? Prevention of hypothermia, infection, neonatal resuscitation, and the 4th thing is early exclusive breastfeeding. Till 6 months, of course, early exclusive breastfeeding. So how to remember NSSK? Very simple. जैसे ही बच्चा पैदा होगा, हम पहले उसे सीने से लगा के हाइपोथर्मिया से रोकेंगे. कंगारू मदर केयर वी विल गिव, प्रिवेंट फ्रॉम हाइपोथर्मिया. फिर दूसरा चीज क्या रोकेंगे? इन्फेक्शन रोकेंगे. हाइपोथर्मिया, इन्फेक्शन वी विल प्रिवेंट. अगर बच्चा बच गया तो मां का दूध पिलाएंगे. अगर नहीं बचा तो रिसक्सिटेट करके बचाने की कोशिश करेंगे. ठीक है? सो प्रिवेंट फ्रॉम हाइपोथर्मिया, इन्फेक्शन, देन डू ब्रेस्ट फीडिंग. इफ you are unable to prevent, then you will do resuscitation. This, do remember one more thing. They have asked, BFHI do not focus on which of the following? BFHI means baby friendly hospital initiative. Prevention of infection is not a priority of BFHI. Prevention of infection, not priority of BFHI. So in NSSK also we give training to doctor and nurses, but NSSK focus on prevention of neonatal death and Dakshata focus on prevention of maternal death. So this was the difference between them. I hope you will remember. Okay. Now, if you have any other question, feel free to ask, just like Gurudat. Very good, dear. All of the following statements are true for descriptors of central tendency. That's the question which we just discussed. Central tendency, if you want to know, no, this is not the question we discussed, and this is something which we want to know. Mode, do remember this thing? This was being asked in FMG also, one exam back. They gave a data of something like this, 4, 6, 19, 20, and then they gave 49. And they say, if 49 is replaced by 94, okay, 49 is replaced by, let's say, 94, then which one is affected? So do remember, median is always in the center. Median beech ka hai. So median will remain the same. Median is not affected by big number. Okay. And median is calculated by overall observation. We arrange them and the middle number become median. And if there is no middle number, then average of middle two number will become median. So median is overall observation. I already discussed that mode can be used for qualitative data. For qualitative, what we are using? We are using median and mode for qualitative. And mean is most affected. So which one is not true, except they are asking. So mean is affected is also correct. Mean is affected is correct. Median is overall observation is correct. Mode, median are for qualitative data, correct. Mode is affected by extreme value. This is wrong answer. Mode means most commonly repeated number. That's why Park has said mode as model. Just like model keep appearing again and again, mode keep repeating itself again and again. So mode is affected by extreme value. This is a wrong statement. Mode is the repetition. Let's say we have 4, 4, 6, 9, then 4 is the mode. And even if we change 49 with 94 extreme value, mode will remain the 4. So mode is not affected. Affected is a wrong line. Okay. Now, if I did this 4, 4, 6, 19, 28, 49, what will be the median? Now the middle two number is 6 and 19. We will take average of 6 and 19. It will be 25. 25 by 2 will be 12.5. That will become the median. So do remember, mean is affected. If I change 49 with 94, what will be the effect on mean? Mean will increase. If I increase the extreme number, mean will also increase. ऐसा समझ सकते हो, mean minded है. Mean get deviated towards big number, and it is mean minded. Mean increase if you increase the number, extreme number. And if they will give you this type of distribution with a very big number at the end, then what is the most ideal measure of central tendency? Will you use mean, median, or mode? If there is a big number at the end, better is to use median, because mean get affected by big number, but median do not get affected by big number. So if there is big number, we will use median. Okay. Now, coming to the next question. This is one question very frequently asked. So this was the questions from INICET 2023. Now we are going to INICET 2022 questions. Under Anemia Mukt Bharat, I will ask 3 questions related to it. In recent FMG also they ask a lot of questions from Anemia Mukt Bharat. So in Anemia Mukt Bharat initiative, mild to moderate anemia in pregnant female less than 34 week. What is the treatment? Okay, what is the treatment? Will you give 3 iron folic acid tablet? Will you give IV iron sucrose if iron tablet are not working? Will you give 2 tablet plus IV iron sucrose, or will you give IM ferric carboxymaltose? So this question I am asking from all of you. What is the answer of this question? Rahul Kumar Sinha is saying C. Harpreet Singh and Adnan Ahmed are saying A. Okay. Harpreet Singh is also saying love you, sir. Love you, bro. Thank you. And any other answer other than this? Okay, so first of all, maximum dose of IFA tablet is 2. We can never give 3 tablet. This is the wrong answer. In any case, 3 is not given. Second thing, if you give 2 iron tablet, then we do not give iron sucrose. Whenever we give IV iron sucrose or IM ferric carboxymaltose, we stop iron tablet. Okay, so tablet plus IV IM iron dose, not correct. IV iron sucrose is given if patient is not taking oral IFA, or if they are taking oral IFA but still hemoglobin is not improving, then we give IV iron sucrose. And here it is less than 34 week. If female would have come very late, suppose female came at 38 week. So if she came so late, 38 week or 36 week, 34 to 38 week in this time, and the female have HB which is less than 9, let's say less than 8 or something. In this case, we don't have the time 8 or 9. In this case, we don't have the time to go for oral iron tablets. So directly answer will be IM ferric carboxymaltose or IV iron sucrose. Directly we will give that if she is very late. But you have to look at the gestation period which is less than 34. So we will still try with iron tablet. If iron tablet will not work, then we will go with IV iron sucrose. Now, in the same question, let's say I ask you this question that there is an adult female with HB equal to 9. So she is anemic. What is the correct treatment which you will give? According to Anemia Mukt Bharat. According to Anemia Mukt Bharat, correct treatment will be what? And that is your question. Option A. Will it be 1 IFA? And in the IFA, I hope you all know 60 milligram iron is there and 500 microgram folic acid be there. So 1 IFA daily, or will it be 2 iron folic acid daily, or will it be 1 IFA per week, or will it be 1 IFA twice a week? So what will be your answer if the female come with HB9? What is the answer which you will give? And this is an adult female, not a pregnant female. Students are writing answer as C. Okay. C. Okay. My dear friend, see, first thing is that here patient is already anemic. And in Anemia Mukt Bharat, the treatment which we give in adult female is 1 IFA per week, but this dose is for prevention. And here we are not focusing on prevention. Here we are focusing on treatment. So what is the anemic female treatment they are asking? And for treatment, we give 2 iron folic acid tablet daily. If it is adult female or pregnant female or lactating female, does not matter. For treatment, we give 2 IFA daily. 1 IFA per week is for prevention in adult female. But if I ask for prevention in pregnant female, how much we give? I hope then you know the answer, that 1 IFA daily. This is for prevention in pregnancy and lactation. So this was the PYQ of FMG exam. Do remember, 2 IFA daily will be given for treatment. 1 IFA daily will be given for prevention but in pregnancy lactation, and 1 IFA per week is given for prevention in adult female. Twice a week we give 1 ml IFA syrup to less than 5-year children. Twice a week is only for less than 5 year, and in that 1 ml IFA syrup there is 20 milligram iron plus 100 microgram folic acid. So for less than 5 year, it is twice a week. And 3 group, pink, blue, red, PBR is the mnemonic. Pink is for 5 to 10 year children, in which there is 45 milligram iron plus 400 microgram folic acid. Blue is for adolescent, in which there is 60 milligram iron plus 500 microgram folic acid. And red is for adult female. It is also for pregnant lactating female. So these 3, adult female, 10 to 19-year adolescent, and 5 to 10-year kid. These three, they get tablet once a week. Adult female, adolescent, and children, they give it once a week. Just like movie in PVR are released once a week, so PBR tablet is also given once a week. Okay, so do remember these doses. They keep asking Anemia Mukt Bharat question again and again. What is the target of Anemia Mukt Bharat? To reduce anemia each year by 3%. What is the target in Poshan Abhiyan? The target in Poshan Abhiyan is to reduce malnutrition, stunting, wasting by 2% each year. So Poshan Abhiyan target 2% and Anemia Mukt Bharat target 3%. Now next question is from the drug image shown here, and they have written here artesunate, sulfadoxine, pyrimethamine. So definitely it is the treatment of malaria. But the twisted question which comes from here is that if the female is pregnant and this pregnant female have Plasmodium vivax infection, what is the drug of choice which you will give? Option A, will you give chloroquine plus primaquine? Option B, will you give only chloroquine? Option C, will you give quinine? Or option D, will you give artesunate combination therapy? So what is the answer? This was again a PYQ of FMG exam, but it can be repeated anywhere in NEET also. So do give the answer. Mohammad Sahnawaz Khan is giving the answer chloroquine directly. Adnan Ahmad is giving answer something else B, and chloroquine is the answer by Kansika also. Artesunate can be the answer if the female is not pregnant, but there is one more thing, pregnant and vivax, both things are there. And artesunate is contraindicated in first trimester of pregnancy. And artesunate is the drug of choice for falciparum malaria in other states except northeastern states where we use artemether lumefantrine. So in first trimester of pregnancy, if any female come with Plasmodium falciparum, then what we give? We give quinine. Okay, first trimester of pregnancy with falciparum, we give quinine. And this is the mnemonic which my friend Ankur Jain has told me. We used to do this Chote Miya Bade Miya, and this is the studio of Ankur Jain sir only where I am taking this class. And he told me that we should keep pregnant female as queen in first trimester. So that's why the drug of choice in first trimester for falciparum will be quinine. So that is the answer. Now, why option A will not be there? Because I hope you all know primaquine is contraindicated in pregnancy, contraindicated in infant, and contraindicated in G6PD deficiency. So in 3 cases, pregnancy, infant, and G6PD, it is contraindicated. So we don't give it. That's why the answer come out to be correct is chloroquine. Now, in this story, they create something else and they ask this thing that there is a female or there is a patient came from Assam to Delhi. And now with Plasmodium falciparum infection, this patient is there. What is the drug of choice? Okay, so the drug of choice will be, will it be artesunate or will it be artemether? Artesunate or will it be artemether with lumefantrine? What is your answer? A or B? Because I hope you all know chloroquine is for vivax. Here it will be artesunate or artesunate or artemether and lumefantrine. And if I change the question, first they can ask Assam to Delhi, then they can also ask Delhi to Assam. Then what will be the answer? So this 2 type of confusing question they can create. Remember my friend, whenever they may write any northeastern states, Mohammad Sahnawaz Khan is writing answer B. And Rahul Kumar is also writing artemether. Gurdat is also writing artemether. Very good. Answer will remain same. Gurdat has said same. Answer in both case will be artemether. Why? Because if someone is coming from Assam to Delhi, they might have the resistant strain of falciparum on which artesunate do not work in northeastern states. And if someone is going from Delhi to Assam, they might have developed malaria by falciparum in Assam with the resistant strain. Artemether work in all areas, but artesunate do not work in northeastern states, because in northeastern state artesunate resistance has been found. So answer will be only B, artemether plus lumefantrine, and the ratio in which we give artemether lumefantrine is 1:6. So if you give 40 milligram of artemether, you will have to give 240 milligram of lumefantrine. Do remember this thing, okay? Very commonly asked question, and I hope you will not confuse. Very good. Chalo. Now, they have said this, given this question, and broken septic tank is there. Breeding mosquito is there. Which mosquito breed in dirty water? Septic tank. That is Culex, nuisance mosquito. So it has nothing to do with the image of the larva. Just based on that septic tank, you can answer it as Culex. But if they gave an image of flat floating larva, this is not flat. This is flat will be straight, है ना? Flat or parallel larva in clean water, then that will be Anopheles. Similarly, if they ask which mosquito have spotted wing, student answer it is no. किसकी चुनरी में लगा है दाग? चुनरी में दाग लगा है Anopheles के. Anopheles have a spotted wing. Aedes will have stripes, black and white stripes on leg and body, but wing will be spotted in case of Anopheles. Okay, chalo. Now, next question. A child present with dog bite from street dog on examination, and abrasion of 1.5 cm is present with slight oozing is also there. Which statement are correct? Because there is oozing or blood come out, so it is category 3. कैटेगरी 3 में कौन कौन होता है? चमगादड़ का काटा, बैट बाइट, कुत्ता आया और लपलपा के लिप टू लिप किस दे के चला गया, है ना? म्यूकोजा, लिकिंग ऑन म्यूकोजा. देन स्क्रैच ऑन फेस is category 3, and any bite with bleeding is category 3. So 4 things are category 3. It is definitely category 3. Wash the wound, definitely we will wash it for 15-20 minutes. Clean the wound with spirit, that is also we do, but we never put any stitch, or stitching is not done, but we do the cleaning. So 1, 2, 3 is done. Loose suturing, no, we never do suturing or stitching. Equine immunoglobulin 40, no. First thing is equine immunoglobulin dose is 40, but what we prefer? We prefer human immunoglobulin, है ना? इंसान का बच्चा है तो इंसान लगाओ, human immunoglobulin. And this human immunoglobulin dose is 20 international unit per kg. It has been asked in one of the INICET already. Do remember, 20 is for human. So we will not give 40 to this child. And intradermal vaccine is given on day 03728. This is correct. Intradermal is administered on 03728. But if the dog is alive after 10 days, we do not give 28-day dose. So 1, 2, 3, and 6 are correct, which is option D, 1, 2, 3, and 6. Okay. Now, see, the same question is being repeated, and you can see the square root with the square, so it is a standard deviation formula. Shall I tell you all about this 5 thing which is there? See, when we measure dispersion, dispersion means spread of data. रायता कितना फैला है, and which type of raita or curd you like? One in katori to the point, or which one which is spread? And of course we want the data or curd which is to the point, because if it is spread, how will you eat it? Very difficult to eat now. So it should be, dispersion should be minimum to the point. Now to measure the dispersion, first thing is range. Range means highest minus lowest limit is range. So let's say I want to give you a party after the class, and I ask how much you will drink, and you drink, I will say, someone said 4 liters, someone said 100 ml. So this will become the range, है ना? But this range is not giving me any idea how much you will drink. If I arrange 4 liters for all of you, it will be a lot of wastage of drink. And if I arrange 100 ml for all of you, you will say कि बे मोटे औकात नहीं थी तो बुलाया क्यों? Why you call us for party if you don't have the money? So it will not give us the real idea how the data is distributed, how much you will drink. So then we can use mean deviation. है ना? We can select any 3 students from the group and we can ask how much you will drink. Suppose someone said 1 liter, second one said 2 liter, third one said 3 liter. So in mean deviation, we will first find the mean, which is 2, because it is symmetrical, so middle number become mean. Then we will subtract each number from the mean and we will divide it by sample size minus 1. Why we will divide it by sample size minus 1? Because this is degree of freedom. If I have 5 finger, suppose out of 5 finger, how much I can choose? I can choose 1, 2, 3, 4. But if last one is left, I have no degree of freedom. So out of 5, I can choose only 4. And that's why degree of freedom is sample size minus 1. So this is the formula of mean deviation. Now, if you do it, 2 minus 3 plus, and you add all of it, mean minus number, plus 2 minus 1 divided by 3 people minus 1. Finally, it will come 1, 2 minus 3 will be minus 1 plus 1 by 2 and it will come 0. So should I arrange 0 drink for all of you? And that will be wrong data, wrong answer. Why this wrong answer is coming? Because minus and plus sign are cancelling each other. So to get the correct answer, we have to remove the minus sign. And to remove the minus sign, we can do two things. One is in board mass, we have read in school that we put a magical bracket which remove the minus sign. So this magical bracket is there in the formula of mean deviation. It will remove the minus sign and finally we will get 2 by 2 or 1. So you can see each number is away from the middle number by 1. That is mean deviation. How far is each number from the middle number? That is 1. So this is second thing, mean deviation. But there is one more way to remove this minus sign, that is to do square, because minus into minus become plus. So in mean deviation, the formula is mean minus number sample size minus. In variance, the formula will become mean is written as x bar, number is written as mu, sample size minus 1, and we will do square to remove the minus sign, that is variance. But we don't want it to do the square. We have to do the square to remove the minus sign. So ultimately, we have to remove the square. How can you remove the square? By doing under root, and that will become the formula of under root, which is mean minus number whole square, sum of them by sample size minus 1. Till the sample size is 30, we do n minus 1. After 30, we only write n. So this is the standard deviation, and last thing is standard error. Standard deviation is for 3 people sample, standard error for the whole class. So these 5 things tell us about dispersion, and you will never be confused in the identifying the formula if you know the 3 simple steps. What are the 3 simple steps? First step, that we will do mean minus number and divided by sample size minus 1, which is degree of freedom. Second step, to remove the minus sign, we did a square. Third step, to remove the square, we did under root. So if you remember the 3 steps, you will never be confused. There should be these 3 things. There should be square to remove minus sign, n minus 1 as degree of freedom, and under root to remove the square sign, that will become a standard deviation. And if you remove the under root formula, it becomes variance, because the standard deviation is under root of variance. So variance will not have the under root thing as we write here. Okay, so do remember it. Now let's come to this matching the formula. Walter Reed, have you heard of it? Walter Reed talk about yellow fever. Edward Jenner is the one which gave the first vaccine of smallpox. And Lind is as did the first RCT. He took 12 seller, divided them into 6 groups. In first group of 2, he gave milk product. Second group of 2, he gave citrus fruit, like that and all. And he observed that the group who received citrus fruit did not have bleeding from gum or collagen synthesis defect. So that's how the first RCT was done, and scurvy prevention by citrus fruit was proven. So Walter Reed, yellow, that means 1 is B, 2 is C, 1 is B, 2 is C, 3 is A, only option D is correct. Okay, and first RCT is also by Lind, do remember. Now contraceptive failure is assessed by which of the following? One is Pearl index, other is life table analysis. Life table analysis is better, because life table analysis can be used even for one woman, we can use it. Even for one female, we can use life table. But Pearl index, whenever we measure Pearl index, it measure failure rate in 100 women year. Why it measure it in 100 women year? Because in Pearl index, we multiply by 1200. In 1200, there is 100 and 12 are the months, so it becomes 1200 is the multiplication factor, so it becomes 100 women year. And what is the formula of Pearl index? Pearl index formula simply means how many accidental pregnancy occur divided by number of female taking it and how many months they have taken the contraceptive. So female into month we will do in denominator. Accidental pregnancy above, multiply by 1200. Remember, Pearl index is in 100 women year. Now match the following with relevant description. Pre-pathogenesis. Pre-pathogenesis means period before onset of disease is pre-pathogenesis, in which we do primordial and primary prevention. So one is D, and only one option correspond to one is D, that is B. So answer will be direct D. That's why matching question is many times much simpler. Pathogenesis means it is the phase in which clinical signs symptom occur. Natural history is pathogenesis is B. Natural history means normal course which will occur if no one did any surgery intervention. Normal thing occur is natural history. And rehabilitation is trying to make the person self-dependent. Reaching normalcy with help of community is rehabilitation. So 4 is C, 2 is B, 3 is A. Correct answer is B. Now, which of the following criteria should be satisfied to start multiple drug therapy in leprosy? Many a time we have to start MDT in tribal area where we don't have facility of doing skin biopsy and ZN smear. So skin biopsy, okay if it is present, but it is not absolutely required. If there is hypopigmented patch with sensory loss or peripheral nerve thickening with sensory loss, if these two things are there, basically it's three things: hypopigmented patch, sensory loss, peripheral nerve thickening. If these three things are there, we call it as leprosy. So hypopigmented patch, peripheral nerve with sensory loss, correct answer will be 1 and 3, option B. If these two you found, leprosy is confirmed. Okay, there will be a lot of question on leprosy. We will discuss it in other questions. Which is true for regarding anti-tubercular drug treatment? Isoniazid inhibit mycolic acid synthesis. Okay. Pyrazinamide is an enzyme inducer? No. Pyrazinamide, just like isoniazid, they both work on mycolic acid synthesis inhibition. So second option is wrong. Which one is an enzyme inducer? I hope you all know. Rifampicin is an enzyme inducer. And rifampicin is not only used for treatment of tuberculosis, it is used in other disease treatment also. And they have asked this question that if a patient is HIV positive, pregnant female, then which drug concentration should be interfered? Rifampicin, because it is an enzyme inducer, also induce metabolism of dolutegravir, which is given for treatment of HIV. You know? So if someone is taking HIV and TB drug, which drug concentration should be increased or affected? Dolutegravir concentration get affected. Okay, because this is something which get induced by rifampicin. So we should increase the dose of dolutegravir. Do remember one more thing, dolutegravir is also something which can cause neural tube defect. That's why when we are giving dolutegravir in pregnant female, we will increase the folic acid dose to prevent neural tube defect problem. Bedaquiline inhibit ATP synthesis. Do remember it? And linezolid. Linezolid along with isoniazid and pyrazinamide, they all three inhibit mycolic acid synthesis. So this bedaquiline is correct, option 1 is correct, but remaining option 2 and 3 are wrong. So 1 and 4 are correct. Correct is D. Now we should also know the side effect with this drug. Both this isoniazid and pyrazinamide both work by the same mycolic acid synthesis inhibitor, and both have this side effect of peripheral neuropathy. Both also have a common side effect of affecting liver function test, decreasing the affecting the liver enzymes and liver functions. Okay, so decreased or deranged LFT can also be there in them. Okay, rifampicin, of course, it will have orange discoloration of urine. Along with that, there is renal side effect of using rifampicin. If it is ethambutol lead to red-green color blindness. That is why we do not give ethambutol in less than 5-year children. We try not to give it because in less than 5 years they will not be able to tell that I am unable to differentiate red and green. So we don't give to them. Okay, so do remember the side effect, their mechanism of action, although it is pharma part, but very frequently asked. Following an earthquake, we are trying to make earthquake resistant building. This is known as mitigation, because mitigation means decreasing impact of future disaster. Okay, like if you are planting tree, if you are making houses away from river bank, these all are mitigation. It will prevent future flood, future impact. Okay, we will discuss disaster cycle also in one of the question which has been asked above earlier. Attributable risk. If they ask attributable risk is 90%, what does it mean? This was a really confusing question. Try to answer it if you can. First option, does it mean 10% of cases of lung cancer can be eliminated if a smoker is eliminated? Or does it mean 90% cases of lung cancer can be eliminated in the population if smoking eliminated? Or does it mean 90% case of lung cancer can be eliminated if smoking is eliminated? Sorry. So what is the difference between option B and C? B is saying that 90% can be eliminated in the whole population. And C is saying 90% can be eliminated in smokers. In smoker means who are exposed, doing something wrong. They are the one who are exposed. Smoking is the risk factor which lead to lung cancer. So when we talk about attributable risk only talk about exposure population. So correct answer is C. If it is population attributable risk, then they will talk about population. Okay, let's revise the three formula and their meaning with a simple example. Suppose there are 100 driver who drink and drive, and there are 100 other driver who are non-alcoholic. And let's say in this 100 drink and drive driver and non-driver, you did follow up for 3 years. And after 3 years, you found in this group out of 100, 80 had accident. In this group out of 100, only 20 have accident. So first thing is relative risk, in which incidence in is exposed is compared with incidence in non-exposed. So if you found ratio of exposed with non-exposed, ratio or exposed compared by non-exposed, ratio or by word if you found in the exam, answer will be relative risk. Attributable risk formula is incidence in exposed minus incidence in non-exposed by incidence in exposed into 100. And in attributable risk, what we are trying to know is how many accident in the alcoholic group is due to drink and drive. Like, let's take this example. 80 accident is in alcoholic, 20 is in non-alcoholic. That means how many are due to drink and drive? Dekho, 20 will do accident anyway. Here accident is being done in 80. 20 will do accident anyway. So 80 minus 20 if you will do, 60 extra case are occurring due to drink and drive. बात समझ रहे हो कि नहीं? 80 लोग दारू पी के ठोक रहे हैं, 20 लोग बिना दारू पिए भी ठोक दे रहे हैं. तो कितने लोग दारू की वजह से ठोक रहे हैं? How many are doing accident due to alcohol? That is exposed 80 minus non-exposed 20 divided by exposed. And so 80 minus 20 is 60. And how much? 60 is total alcoholic 80. So 60 by 80 if you will do, it will come 3 by 4. 3 by 4 means 75%. So we can say 75% accident is due to drink and drive. In which group? किन लोगों में ये 70% एक्सीडेंट हो रहा है, 75% एक्सीडेंट हो रहा है? ये हो रहा है उनमें जो पिए हुए हैं. पिए हुए 80 में से 60 का एक्सीडेंट हुआ है. This 75% is among the group who are alcoholic or exposed. It is not among whole population. This 75% accident due to drink and drive in exposed, not in whole population. And whenever we will talk about PAR will talk about whole population. The formula is incidence in population minus incidence in non-exposed by incidence in population multiply by 100. So PAR will tell us कि अगर लोग दारू पीना छोड़ दें तो पूरी जनता में एक्सीडेंट कितना कम होगा. PAR will tell us if the whole people will stop drinking in this study, how much accident will decrease by in the whole population. So if you find the word decrease by in question, that is PAR. Decrease by in whole population, not in exposed. If you find the word due to, it is attributable risk. If you found the word ratio or by, that is relative risk. And relative risk, measure it in time. How many time more? Like here, 80 accident in alcoholic, 20 in non-alcoholic. So how many time more accident are occurring? 4 time more. So that is the relative risk. It comes in time. And relative risk tell about strength of association best. AR and PAR are used by public health expert like us. RR is used by clinician. And out of AR and PAR, which one is better to tell people, give any information to people? PAR is better, because PAR talks in a positive way. So that is more better way to give information to public. Okay. So do remember and revise this formula and their uses. They keep asking questions from it again and again. Now, which model is there? So this is an image-based question which is on sufficient component cause model. Let's say you want to know the cause of lung cancer, or let's say you want to know the cause of diabetes. And again you are finding that stress is there, plus no exercise is there, plus let's say smoking in one person. In another person you found B is stress. So you found again stress, but along with stress you found high fat diet, and with 1000 kilocalorie, 50% coming from fat around. And then D is, let's say, drinking alcohol, and C is, let's say, steroid treatment. And so there can be multiple reasons of diabetes. And again in 5 patients, we are supposed trying to find the reason of diabetes. But every time we are finding that stress is there, B is always there, stress is always there. That means stress is, according to sufficient component cause model, stress is one thing which is needed to cause diabetes. Without stress, it will not occur. And this is one thing which I have found it in practicality also. Many people who are thin and all, they also develop diabetes because of stress. So do not take it and enjoy the journey, whatever the situation is. This is sufficient component cause model, not pie chart. Pie chart will have 100% and then they will be distributing it like this, like 70% should be carb, 15% protein, 15% fat. This is pie chart, and this question has also been asked that which diagram is used to express balanced diet to layman. Pie chart is used to express balanced diet to layman. Okay, balanced diet to layman. Now let's move ahead and let's see this question on vaccine while monitor, VVM. Vaccine while monitor, what does it tell? Does it tell the expiry of the vaccine? It only tells whether temperature has been properly maintained or not. So in vaccine while monitor, first thing is it is used for monitoring heat exposure. Very good. It does monitoring heat exposure. Second option, it's so cumulative exposure of vaccine to heat. Yes, it does tell us how much heat is being given to that vaccine. Does it indicate how much efficacy? Efficacy means, let's say Covaxin is 81% efficacious. It means the people who is fully vaccinated with 2 doses of Covaxin 6 weeks back has 81% less chance of hospitalization as compared to unvaccinated person. So efficacy is not told by VVM. VVM also do not talk about expiry date. Expiry date options are also ruled out. Efficacy ruled out. Square and circle are same in color, vaccine can be used. No dear. If it is same in color, outer square and inner circle, if both are same in color, we will reject vaccine, not use it. So all the below 4 are wrong, only 1 and 2 is correct. So the correct answer will be B. Now, which of the following indicator can help in determining whether the health system is giving importance to identifying leprosy in community or not? It's a question based on common sense. Let me see whether you can answer it correctly or not. Kindly do give me the answer if you understanding it. This logical question. There are 2 questions came on this logic. I will ask you the second question also. The one more question was there. Suppose they have one more option. This multibacillary leprosy. Percentage of multibacillary leprosy cases out of total case. So we want to know whether ASA is checking for leprosy properly in the population or not. Okay. So which will tell us about this whether ASA is properly checking or not, which indicator will tell. Try to answer it. And the second question that can come from this part is, which of above 5 is not an impact indicator? Not an impact indicator of leprosy program. Do you understand what is impact indicator means? Impact का मतलब कि as compared to previous year, leprosy is decreasing or not? Leprosy program is bringing any ground impact or not, है ना? लोगों का leprosy program के चलते फायदा हो रहा है कि नहीं, ये किससे पता नहीं चलेगा? Not an impact indicator. ये दो क्वेश्चन यहां से आ चुके हैं. किससे पता चलेगा कि आशा सही से खोज रही है, और किससे पता चलेगा कि लेप्रेसी प्रोग्राम असर कर रहा है कि नहीं, किससे नहीं पता चलेगा? नॉट एन इंपैक्ट इंडिकेटर. दिस आर टू थिंग, वेदर आशा इज वर्किंग और नॉट, एंड वेदर लेप्रेसी प्रोग्राम इज ब्रिंगिंग चेंज और नॉट. सो व्हाट विल बी द आंसर? सी माय डियर फ्रेंड, if we are getting a lot of newly diagnosed patient is coming with grade 2 disability, it means search for leprosy cases is not occurring properly. It means health system or ASA is not giving importance to identifying leprosy case. So then here the answer will be D. Okay, but if I want to know which is not impact indicator of leprosy program, answer will be option E. Because if multibacillary cases are more, it only means multibacillary is just a type of leprosy, more than or equal to 6 skin patch multibacillary. So if multibacillary are coming more, it does not tell whether leprosy program people are working well or not. है ना, ये तो बस बीमारी की एक स्टेज है ना, it's just a stage. It is not telling us the impact. Who will tell us the impact? Impact is being told by 3 things. Actually 4 things tell us the impact. Impact indicator, first one is annual new case detection rate, which is 9.7 per lakh population of India. Second impact indicator is percentage of patient with relapse of leprosy. Relapse of leprosy. If more relapse is occurring, it means leprosy program is not working well. Third impact indicator is percentage of patient with grade 2 disability. If patient are coming with grade 2 disability, it means leprosy program is not detecting it early. है ना? So annual new case detection rate, relapse of leprosy, percentage of patient with grade 2 disability, this all will tell us the impact, but multibacillary case will not tell us the impact. Okay? And for leprosy, do remember one more thing. If prevalence of leprosy is less than 1 case per 10,000, then we say that leprosy is eliminated. And in India, this burden has decreased. In 2005, leprosy cases prevalence decreased to less than 1, and right now it is 0.66. So India eliminated leprosy in 2005, very way back. And do remember that for leprosy elimination, the criteria is less than 1 case per 10,000. But for neonatal tetanus or filariasis, the criteria is less than 1 case per 1,000. Neonatal tetanus filariasis less than 1 case per 1,000. Okay, chalo. So not giving importance, I will know it by proportion of newly diagnosed with grade 2 disability. So this image-based question is given in the next question. There is a lymphatic filariasis hathi paw patient, elephantiasis patient, and they are doing the cleaning of the area. So under which example it will come? Specific protection, disability limitation, primary prevention, which will be under it? Yes, my dear friend, will be under it. This is tertiary level of prevention, because we are trying to make the person self-dependent. We are trying to prevent the disability from further progressing. So this is tertiary level disability limitation. Okay. Now, specific protection is for primary level, and I hope you all know the example, but let me ask you some questions from here. If I ask that a son took hemiparesis father for checkup, under which example it will come? For checkup, secondary, tertiary, primary, or primordial? Can you give the answer? This is already a PYQ. Very good. If son took hemiparesis father for checkup, okay, let me ask another question which will clarify this first question. If son took hemiparesis father for physiotherapy, physiotherapy will make the person self-dependent. It is tertiary level. But if the person is taking, son is taking the father for checkup, checkup will do early diagnosis and treatment. And early diagnosis and treatment, this come under secondary prevention. So all screening tests are secondary prevention. If I ask this question, स्वास्थ्य मेला में हो गया खेला, स्वास्थ्य मेला, in a health fair we are taking BP. So wherever we are taking BP, BP is screening test, and all screening test purpose is early diagnosis. Checkup is for early diagnosis of second attack of hemiparesis or second attack of a stroke. So early diagnosis and treatment come under secondary. That's why it will be secondary. If I take BP of a 10-year-old kid, that is also secondary, because in 10-year-old kid due to nephrotic syndrome, BP can be raised, and we are making an early diagnosis. So whenever there is early diagnosis or screening test, it is always secondary. Okay, very good, Muhammad Sanawaz Khan. Only Dr. Adnan and Muhammad Sanawaz Khan, all of you have replied. Thank you so much, and you are correct. Very good, Kanshika, you were also correct. That was tertiary level. Now let's come here. This is a complex question, but this type of question can come again also in simpler way, but try to understand this. What they are doing is, they are giving result of a study, and they are asking which are significant. You just have to tell me which are significant factor. So for significant factor, first criteria is that relative risk or odds ratio should be more than 1. They are not only asking significant causative factor. Causative means, like let's say alcohol with accident. More you drink, more you will do accident. So alcohol is causative, and a causative will come if relative risk odds ratio more than 1. First criteria. Second thing is that p value should be less than or equal to 0.05. Only then we call the data as significant. Third criteria is, which they have not given here, but they can ask the question on that also, that 95% confidence interval range should not have 1. Because 95% confidence interval range is usually in relative risk or odds ratio. And if it has 1, let's say it is 0.8 to 1.4. And suppose this is a medicine which my friend Anurag Jakar is giving, and is in the group. He became cardiologist, and now he found a drug which will lower the BP. And his result is coming 0.8 to 1.4. So 0.8 means when you took Anurag Jakar drug, the BP is less. 1.4 means when you took Dr. Anurag drug, BP will be more. So if the same drug is lowering BP, increasing BP, it means the drug is not related with BP. है ना? समझ रहे हो ना? if after taking milk sexual performance decrease, 0.8 means negative association decrease, and after taking milk relative risk of 1.4 sexual performance increase. So if the same milk is decreasing sexual performance, increasing it, it means milk is not related with sexual performance. Try to change the partner, that or other work. So if the range have 1 means non-significant. So do remember this 3 rule. 3 rule means study is significant. So significant will only be if their relative risk is more than 1. Relative risk is not more than 1 in 0.3, not more than 1 in literacy. So female and literacy thing cannot be significant because it is 0.3. 0.3 means negative association. Negative means it is not causative, it is negative. That's negative means it is protecting. Okay. If you are female, then blindness will be less. If you are literate, blindness will be less. That's why 0.3 means less. Second criteria, p-value less than equal to 0.05. So p-value is more than 0.05 in male. You can see more than 0.05 here, more than 0.05 in here also. That means male and rural population, this also is not significant. So non-significant is removed. Rest can be the significant factor for blindness. So option A, female population is at greater risk. No dear, female population is at lesser risk. Why it is lesser risk? Because odds ratio is 0.3 less than 1. So female is actually lesser risk. This statement 1 is wrong. Statement B, people dwelling in rural areas are at increased risk of developing blindness. Rural area 2.4 is coming, so they are increased. They are at more risk. But problem is p-value is coming 0.1. And p-value 0.1 means study is non-significant because p-value is a mistake. It's like alpha error only, false positive only. And it should be less than or equal to 5%, less than or equal to 0.05. Here it is 0.1. So rural population increased risk is also wrong because of p-value. Option 3, risk of developing blindness increase with age. Yes, it can be correct and you can see it. 50-year risk is 1.1. 60, 50, and a risk is increasing with age. So this option 3 is correct. Option 4, illiteracy rate lead to increased risk. Illiterate odds ratio is coming 1.2 and p-value is less than 0.01. So p-value is also less than 0.05 and odds ratio is also more than 1. That means yes, if you are illiterate, there is more risk. If you are literate, there is less risk. Illiterate, more risk of blindness. Sorry. So why is it so? Because illiterate people go to had lesser facilities for treatment and they are usually poor, so they do not do cataract surgery early and they can become blind with cataract. So that's why literate will have lesser risk, illiterate will have high risk. Anyway, the data you have to focus on to answer this question, and I hope you realize this 3 rule and how to look at this table. I will have another question on this concept also in the same INICET discussion. So do remember which statement are correct. 3 and 4 are correct. 1 and 2 is wrong. Now, let's move ahead and see this thing. Ashish is remembering Johnny's sin with that milk and sexual performance example. Actually, it was in a movie, Meenakshi Sundareshwaram. And in that movie, they gave this kesar flavored milk to the male. So the female partner said, hey, why are you not giving it to milk? Air should be equal in both the tires so that vehicle will go well. And I also need to perform, so I also need the milk. I said, good logic. So from there, I took this thing that whether milk increase sexual performance or not. Okay. Now, Satrughan is asking me to upload the PDF after session. Of course, I will. But you might not be able to understand my writing, but I will still upload the PDF. A point of care diagnostic with sensitivity of 98% show a negative test result in a patient. What does it imply? This is a very good, interesting question. Someone is saying, पीछे वाला कि ये कैसा question है भाई? This is one question which is not so difficult to answer. And just remember these 3 criteria and you can answer such question. And it's unique, but similar question has been asked in past also. Now, focus on this thing. Point of care diagnostic have sensitivity of 98%. Sensitivity is ability to include. If you are sensitive means you will give your shoulder to both boys and girls for crying. किसी का भी दिल टूटे आप उसकी हेल्प करोगे. You will include other people pain in your life. Sensitivity is ability to include. So if sensitivity is high, it means all disease patient included. सभी बीमार लोगों को टेस्ट में पॉजिटिव दे दिया गया है. All disease patient included if sensitivity is more than 90%. है ना? And now someone is getting negative result. है ना? So sensitivity is 98%. It means you have included everyone, almost everyone. Now if someone is getting negative, it means that person must not have the disease. Okay? It simply means patient is less likely to have the disease. Because when we write the formula of sensitivity, in the sensitivity there is two things. One is true positive and other is false negative. False negative means miss out, which got a negative report but still have the disease. जो पकड़े नहीं गए बीमारी होते हुए भी गलती से नेगेटिव आ गए, wrongly came negative, who were not caught, they are false negative, miss out. So it's very easy to remember the formula. You just have to remember that sensitivity is true positive rate. In the numerator there is true positive, and in the denominator you can see there is just opposite of true positive. Opposite of true is false, opposite of positive is negative. And so if you remember true positive, you can remember the formula for sure. True positive, then true positive, and just opposite of that, false negative. Similarly, if you write the formula of specificity, you just have to remember true negative, which you already remember. Denominator is true negative and just opposite of that. What is the opposite of true false? What is the opposite of negative positive? So true negative by true negative plus false positive. Even by closing your eyes, you can answer this question. Okay, so that is there. Now, if sensitivity is high, it means denominator is low. And what is the denominator? True positive and false negative is the denominator. That means miss out is low. Miss out का क्या मतलब होता है? False negative का क्या मतलब होता है? Patient have disease but still came negative. Okay. So if sensitivity is high, we are catching everyone. And if sensitivity is high and still someone is negative, it means patient don't have disease. Okay. Are you getting the concept? Because if sensitivity is high, we are including everyone. False negative is less. So this patient is not false negative. He is less likely to have the disease. This patient will be true negative only because he is not included and he is not having the disease. So he will be true negative. If sensitivity is high, then chances of missing out will be less. Patient is less likely to have the disease will be correct. Does it make sense? Is this concept getting clear to you or not? And for a screening test, sensitivity is most important. For a confirmatory test, diagnostic test, specificity is more important. So let's turn this question other way. If specificity is high, high means let's say more than 95%. Specificity is more than 95% or more than 98%, suppose. Then what is the formula of specificity? True negative by true negative plus false positive. So in this case, false positive will be less, only then specificity will be high. And false positive less means if specificity is high and a patient came negative. If specificity is high, patient came negative, it means patient don't have disease. Because now we will be able to catch all those who have disease. True negative is high. So we will catch all those who have disease. Patient is negative, don't have the disease. But if sensitivity is high and patient came negative, that also means patient don't have the disease, less likely to have the disease. So whenever sensitivity and specificity is high, there is less likely of getting wrong result. Okay. If it is not clear, do ask it from me. Now, next question is this one. This is the question based on health belief model. Now, in health belief model, what does the box C stand for? They ask, but they can ask other boxes also in another exam. So try to remember, understand it. Let's take example of corona vaccination. When corona vaccine was given by Indian government, many villagers were not taking it. First reason was susceptibility, perceived susceptibility. Susceptibility means villagers were thinking that corona occur in urban area, not in village, so we need not to take it. So due to susceptibility, they think we cannot acquire it, so they don't take it. Then severity. Many villagers in the beginning 2020, they thought that corona is just cold and cough, it is not causing death and all, that is just news channel are spreading the rumor, so they have not taken it. So what are the two things? S and S, susceptibility and severity. And then the third is motivation, health motivation. Motivation means, let's say they think, okay, it is less common to occur in rural area, less severe, but still if they are motivated that I will have to take care of my children health, children future, so even if there is small risk, I will take it. So if motivation, and plus government also motivated them by various ad and all, that do take it to prevent other people. So if they are motivated, health motivation is the missing component, they will take it. Then when the villager started taking it, when they realized the benefit that the death can be prevented, so they took it. So there is benefit, B. And then perceived barrier. One barrier is that in rural area hospital are less, so chance of corona vaccine is less. But when at PHC also corona vaccination was done, then they took it because barrier was removed. So benefit, barrier. Okay, susceptibility, severity are above 2, benefit, barrier are below 2, SSBB, and in between you are motivated. SSBB and motivated. So these 5 factors affect our belief and affect our health seeking behavior. Okay, and then we take it. So this, do remember it. Now, and in the health behavior model, health belief model, there is one more here, cue to action. Cue means hint to action. Whenever they open any channel, news channel, there is a ad of COVID vaccine. Whenever they open any news channel, there is hint that corona is causing death. So because of these cues, hint, they were again and again motivated to took the vaccine, took the action. So that's the health behavior model. SS, susceptibility, severity, benefit, barrier, in between motivation, and there should be some hint, cue to action, then they will take the action. Do remember this health belief model. Now, next question is, there is a 1-year-old child, he brought to healthcare that you are working on. His mother mentioned that he had received first dose of DPT at 6 weeks of age, but has not taken vaccine in last 9 months and around 8.5 months. So what will you do now? What will you do now in this next visit? What will you give? So here, the child came back within 1 year. What will you do if patient or child came back in 1 year? Will you repeat the first dose? Will you restart, repeat, restart from first dose? And suppose it is option E. Will you give the second dose? Will you do not give him, or will you give him DT alone? So if child came back in 1 year, we don't restart. We continue with the second dose. Correct answer is option C. Except for 4 vaccine, which we already discussed, BCG, Rota, FIPV, and Penta. These 4 not given after 1 year, but if child came with within 1 year of last dose, child came back, like in this story, child came back within 1 year, so we will give the second dose, we will not restart. Okay, but for these 4, if it is not given in 1 year, we will not give it again. So not given after 1 year is these 4 vaccine. Okay, dear. Chalo. Now let's move to understand this next question, 11. False statement regarding rabies immunoglobulin is, which is the false? It is exclusively given in deltoid. No, dear. We give half dose of immunoglobulin around the site where there is wound and half dose IM. But let's say the bite has occurred in face or on tibia, it's difficult to give half dose around it, so we give full dose IM in that case. The dose is 20, yes. For human immunoglobulin, the dose is 20, correct. Not given after 7 days of first dose of vaccine, yes. Immunoglobulin should be given within 7 days of first dose of vaccine. If human immunoglobulin is unavailable, yes, we can give equine, because equine can cause more allergic reaction, so we do not give it at the beginning, but we can give it if human is not available. So wrong answer is A. Now next question, all of the following cause widening of confidence interval except. So we want confidence interval to be narrow and to the point. The more narrow the confidence interval, more significant the data is. A smaller confidence interval, more significant data. How? Let me explain it with an example. Suppose I ask this question from an intern student or a final year student, who is preparing for exam. Just before exam, I ask that how much marks you will get in NEET exam. Okay, and how much sure you are that you will get this much marks. And suppose I ask it in NEET exam, and how much question you will do correct out of 200. Student said, I will do 150 to 160 correct. This will be the marks. And if I ask the same question, and how much sure you are, if I will ask, the student may say that I am 95% sure I will correct between 150 to 160. So this 150 to 160 is his or her 95% confidence interval range. Confidence interval is nothing but that range within which answer lies. And here the range is 150 to 160. So within this somewhere he will get question correct. But if I ask the same question from a first year student might say that I am 95% sure that I will correct 10 to 190 question. 10 to 190 question. Why such a big range? Because this first year student has not given any mock test or GT, had not done any PYQs. Why this before exam student is having shorter range? Because he had done PYQ. So the more PYQ you will do, more sure you will be that how much marks you will get. And doing more PYQ means you are increasing your observation. The sample size is more. So if the sample size is more, your answer will become narrow to the point, your confidence interval will become small, and it is more significant data. But this first year student have done no PYQ, it has less or zero sample size, no observation. That's why the range of answer is big. So a smaller confidence interval is more significant data. But how can you narrow the range? To narrow the range, to decrease the range, what will you do? Decrease range, you will increase sample size. Do remember this two question. Smaller confidence interval, better significant data, because 150 to 160 is giving us idea that the student will pass. 10 to 190 is not giving us any idea whether he will pass or he will be a topper. So smaller confidence interval, more significant data. And how can you make it smaller? By increasing the sample size, by increasing the observation, you can decrease the range. So do remember this thing. What can cause narrowing of confidence interval? If you increase sample size, it will narrow confidence interval. And I hope this example make it clear. And a more observation, precise answer. Less observation, less sample size, big confidence interval, useless confidence interval. So which will cause narrowing? Narrowing is by increased sample size. Rest all three will cause widening. And this will cause narrowing. I hope this is clear. This is except question. And if it is not clear or any other concept is not clear, feel free to ask the question from me. But I hope you understand this point, that bigger the confidence interval, less significant, useless is the data. And to make the data more better, more significant, we have to increase the sample size, we have to increase the observation. Okay, like if you ask me how much you will run, I will say I will run between 10 meter to 1 kilometer. Because I have never run, so I don't know, because my sample size is less. So my range is very big. But and because of my sample size less, my confidence interval is big. But if I ask it from, let's say, my friend Mohammad Sahnawaz, let's say he's a healthy guy who is running regularly, he will say, sir, I will run between 1 kilometer to 1.5 kilometer. Why he is precise, so precise, less range of confidence interval? Because his sample size is more. He have run again and again, so the confidence interval is narrow by more sample size. Okay, so that's why to make it narrow, we have to increase the sample size. To make it wide, sample size should be less. Next question, isolation in a separate room is mandatory for which of the following airborne infection? For measles and Nipah, both separation is needed. Aseptic meningitis is anyway aseptic and it doesn't need isolation. Tetanus does need isolation, but not in airborne route. Tetanus need dark room isolation. But out of Nipah and measles, the better answer will be measles because it is more readily transmitted by droplets and all. Okay, although Nipah can also be correct, being transmitted by respiratory routes, but the correct, better answer will be measles. Because for prevention of Nipah, the main focus is never on isolation of patients. The main focus is, let's say, on decreasing the various transmitting agent like date palm sap or pig, or by early identification and treatment and all. Okay, so that's measles which is there. Now, which branch of statistics deal with describing the internal collection of data? So, internal collection of data. Collection of data is done either by mean median mode, which tell us the central tendency, or dispersion, which was being told by range, mean deviation, variance, standard deviation, standard error. 5 things tell about dispersion. And these all come under descriptive statistics. They have asked the question on inferential statistics also. Inferential statistics example is confidence interval and standard error. Inferential means taking data from sample and applying it on population. Okay. For example, let's say I ask, and I suppose Nikhil, are you here? Nikhil is gone. So for example, let's say I started called Nikhil and started touching him in this way. I started putting my hand below his t-shirt. Then you will suddenly say that, sir, you are gay. What you have done is you took my one sample behavior and commented about my whole personality. That is inferential. So confidence interval also do the same thing. It will collect data from sample, apply it on the whole population. Like if I want to know how many affairs you had in last 5 years of MBBS, rather than asking it from anyone, I will ask any 3 of you separately that how many affairs you had. And if they said they have 2 to 4 affairs, I will come and say that in this class, 95% of students have 2 to 4 affairs. So this is inferential, small sample size, big meaning. Descriptive is, as I said, mean median mode is descriptive. And standard deviation, range, this is also descriptive. And a theoretical statistics is like alpha beta error, they are theoretical statistics. Analytical is like p-value, null hypothesis. They help us to analyze whether our hypothesis is correct or wrong. And so these are different type of statistics. Do remember, inferential is confidence interval, standard error. Descriptive is all this mean median mode, standard deviation and range. Now next question is management of a baby born to HIV positive mother, which is true. You can answer, try to give the answer. What is true for management of baby in HIV positive mother? First, if replacement feeding, the neonate should be tested for HIV. If negative, ART is not required. See, one thing is sure, whether the child is positive or negative, we will start giving nevirapine since birth and we will give it at least for 6 weeks. And we will stop it at 6 weeks also because nevirapine is hepatotoxic. So even if the baby is negative, we will give nevirapine till 6 weeks. And after 6 weeks, we give two drugs, lamivudine plus zidovudine. These two drugs is given 6 weeks to 6 months. If the patient is unable to have increased CD4 count, if immunity is not rising with lamivudine and zidovudine also, then we can add raltegravir if needed. We will add raltegravir if needed, not necessarily. Okay, so till 6 weeks nevirapine, then lamivudine, zidovudine till 6 months. Okay, so till 6 months we can give this two. Chalo, so the answer is D. And when do we test the child? We test the child at 6 weeks and 3 months. We will do HIV, DNA, PCR testing in the kid. And if at these two results came negative, it means we can stop the treatment. And if it came positive, then we will continue giving this lamivudine, zidovudine and raltegravir till 1 year of age. And after 1 year, we will give LAD, lamivudine, abacavir and dolutegravir, till the person become adult. So this is the treatment for this LZR. This is the treatment for infant. If it is adolescent, in adolescent 10 to 19 year, we give LAD, lamivudine, abacavir, dolutegravir. है ना, वैसे भी कहते हैं माँ का लाडला, अब्बा का वीर. So abacavir we give here. And I hope you all know in adult, what is the drug we give? In adult, we give lamivudine, tenofovir and dolutegravir. So adult who develop HIV, they are now in limited edition. So we give them lamivudine, tenofovir, dolutegravir, 3 drugs, LTD. Okay, and tenofovir is tough. So we give in an adult, but don't give in an adolescent. So we are replacing the tough drug with the softer drug, abacavir. Okay, so this is the treatment which they ask from HIV again and again. Now, which of the following is true statement regarding measures to prevent typhoid transmission in community? Do remember, for preventing typhoid transmission, hygiene is more important than vaccine. Okay, so hygiene practices, clean sanitation is more important. A very good way to understand it is that typhoid and TB, it decreased in UK, England and other European countries also before vaccine and antibiotic came. It decreased before 1900 century. So before vaccine and drug, all this TB, typhoid can be decreased just by improving sanitation. Okay, so main thing is sanitation. Now, a true statement about screening test. Screening test is invasive? No, screening test should be less invasive. Like for prostate cancer, we are taking blood sample and all. But let's say for oral cavity cancer, they have asked this question: what is the screening test? Bimanual finger palpation. We put one finger inside, one finger out, and we palpate it. If it is rough, it is cancerous. If it is smooth, it can be sebaceous cyst or something. So it need not to be always invasive. Screening test has better accuracy than diagnostic test? No. Accuracy is better for diagnostic test. And accuracy is decided by 3 things. One is sensitivity, who decide accuracy. Other is specificity, who decide accuracy. And third thing which decide accuracy is prevalence. How many people in the population have the disease? If more people have the disease, accuracy will be higher. So these 3 things accuracy depend on. Okay. Now, it defines risk of transmission of disease to the child. Screening tests do not define risk of transmission. All the screening tests do not talk about risk of transmission. But in case of genetic disease, there are 2 types of screening: before marriage and after marriage. After marriage, if let's say one child is already born with some neural tube defect or some sickle cell anemia or thalassemia, then we are doing screening to prevent such thing in second child. So basically in genetic disease, we are doing screening to decrease the risk of transmission. Okay. But not in other screening test. Main purpose is to collect all the true positive, to include the people who have the disease. Okay, so but here in genetic disease it is to prevent transmission. One more thing I want to tell you, ask you also, that if they ask the question that IQ is improved in or quality of life is improved in autistic children by giving better care, giving training and care, है ना? There are many training institute who improve the IQ with this. So ये किसका example होगा? It is an example of which of the following? Option A, will it be example of positive eugenics? Will it be an example of negative eugenics? Or will it be example of positive euthenics? Or will it be example of natural selection? What is the answer? So see, eugenics means, if you know the answer, please give, I'm waiting for it. Eugenics means improving the genetics by, let's say, artificial insemination. And let's say someone want to have kid like Virat Kohli, so they will make his sperm come and fertilize. That is eugenics, positive eugenics. And an example is artificial insemination. You are improving the genetics by some genetical manipulation. Artificial insemination, very good example. Then negative eugenics is example is Hitler. What Hitler did in Germany is he did not allow a lot of people to reproduce, especially if they have any defect, disability. He did not let them reproduce. So that is, and he also did not let a lot of people, short stature also, to not reproduce. But Hitler forget that he himself is short stature. Son ki bevkoof kahin ka. So negative eugenics is like that, preventing people from fertilizing. This is example of euthenics. Euthenics means improving environment for better expression of gene. We are making environment friendly so that child will have better outcome expression. And Mohammad Sahnawaz Khan and life sucks is correct for it. Ritesh Bhagat has also replied, very good Ritesh, and doctor is also replying. Thank you so much. So this was euthenics. Now, you are measuring a patient blood pressure at a primary health center with a sphygmomanometer. It felt and broke. What is the next thing you will do? So for mercury, the best way of management of mercury is collect and recycle. But we cannot recycle again and again. Now we cannot recycle in a small setup. So what we do there, we collect it by using card and put it in a jar. That is what we do. Collect or put it in a jar if you cannot recycle. If you will throw it outside, it can cause poisoning or problem. If you swipe and flush it in toilet, again it will go to the soil and it can cause problem. And you cannot just wash hand and go away. Remember, if they ask for cytotoxic drug, what is the best method of disposal? So best method is collect and send it back to manufacturer who have given it to you. But if you cannot do these two things, then the second best method will be that you can do inertization. Second best method, not the first best method. These are the first best. Second best method is inertization, which has been asked also. What is inertization? Inertization means mixing pathological waste and also cytotoxic waste, pathological and cytotoxic waste with 15% lime and 15% cement. So this will make the waste turn into a brick, and now it cannot contaminate the environment. So now the waste become inert. Inert का मतलब अपने में ही रहना, है ना, बाहर ना फैलना. That is inert. Inert means not spreading the infection outside. So do remember, inertization is 15% lime and cement, and it is for pathological, cytotoxic and radiological waste. But we cannot do it for plastic waste. For plastic waste, we do one more thing known as screw feed technology. We put it in a big machine which cut it into pulp of plastic, because most of the space occupied by waste. And if you have practiced in hospital, you might have felt that this garbage bag is usually filled by empty RLNS bottle only. So you have to reduce their volume by this screw fit technology. So for plastic waste, we do screw fit technology, which reduce 70 to 80% volume, and which also reduce 30% weight reduction. Reduce 70 to 80% volume and weight. For plastic, we do screw feed. For pathological cytotoxic inertization, and here we will collect and recycle, or at least put it in a jar separately. Now, next question is, this is a good question through which a lot of related question asked in the exam. Mohammad Sanawaz Khan, Ritesh Bhagat, Rahul Kumar Sinha, and Life Sak all have given the correct answer of the last question. Here, the story start with Sam. Sam developed RAS first. So who is the primary case? Primary case is the first case. So that means Sam is primary case. This is a correct line. Now, after Sam developed it, Rama Devi, mother, ignored it. And after 3 days, Ram also developed RAS. Now, the mother get worried and she took Ram to primary health care center. So Ram is taken to the health department and got noticed first. So Ram is the index case. Index case is the one who is first came in contact with health system. First came in contact with health system is the index case. And then Ram is the index case, Sam is the primary case, so 1 and 2 is correct. Now coming to option 3, Ram got the infection from Sam, maybe because they both are siblings, so this is also correct. Ram could have got post-exposure prophylaxis if the mother has brought him along the hospital when Sam got the RAS. जब Sam को हुआ था प्रॉब्लम तभी राम को ले आती तो उसको दवाई मिल सकती थी, पोस्ट एक्सपोजर prophylaxis मिल सकती थी. Yes, of course, Ram could have got the post-exposure prophylaxis if mother would have brought it. So this is also correct. All 4 is correct. I hope primary and index case concept is clear to all of you. Like I was in the China at 24th December, I came back from China. 24th December 2019, I came back from China. And then I went to Kerala to take a class of foreign medical graduate student. And first case of COVID, first case in India reported on 31st of December 2019. Okay. So, and that was in a foreign graduate. Maybe he was from the same batch to which I was teaching. So, first case India is reported from Kerala in foreign graduate. What is this Kerala student was? This Kerala student was the index case because he came to the report health system. And who was the primary case? Me, Hannah. Because I was the first case, but I was not being caught because at that time they was using only infrared light catchers, not measuring, doing RT-PCR and all. So I might have escaped. Hannah. So I may be the reason why India got COVID, but ghamand nahi kiya, but I can be the reason for killing lakhs of people. So primary case, who is the first case? Maybe he, if I would have been caught at New Delhi airport, then I would have become primary case and index case both. If I got caught, both will be the same. If I not get caught, then I remain primary case and the one who got caught is index case. Okay, so I hope it is clear. Very good, it is C. Now, this question is that India is a country with different culture and diverse language. Which of the following steps should a physician take to address the patient for better outcome? First of all, the doctor should insist on good communication. They should try to learn the local language. Insist on communication via interpreter, no. If you will use interpreter, patient will never feel friendly to you. And plus there is always a third person who is disturbing your privacy. So try to learn the local language. Treat them regardless of their cultural perception. Again, wrong. You cannot treat them according to their perception, according to the fixed protocol. You have to keep changing your perception based on the patient. Like when we were in Aligarh Muslim University during my MBBS, we used to greet patients mostly with Assalamu alaikum. And when I went to Haryana, we were doing Ram Ram. I have to make it into consideration what the patient is coming with, because patient is the one who is giving bread and butter to doctor. So doctor is always below patient. Patient is always above. Do remember it. If you really want to become a really lovable doctor, do remember doctor is below patient. And similarly, in a teacher-student relationship, they taught that teacher are big and all, but I think that student are above, because you are the one who is giving me bread and butter. And so we have to consider patient, religion and cultural perception. So 1 and 4 is correct. D is correct. Coming on to the next question. As per National TB Elimination Program, HIV TB prevalence in a district with high priority districts should be how much? It should be more than 10%. Okay. Then we call it as high priority district if it is more than 10%. So this is a data which you should remember. If let's say relapse is more than 25%, okay, then that means the treatment is not going well, and that is also dangerous. But if it is HIV TB is more than 10%, we call it high priority district. So this is the question from INICET 2022. Now let's take a small break because of the cold and cough. I am feeling that, and let's take a break of 30 minutes and 25 minutes, actually 25 minutes, and class I will restart at 7 p.m. and within one break of 2 hours we will discuss around 150 question for sure. So this 2 hours will be really beneficial for you, and you will get a very good advantage in any exam of NEET or FMG through that discussion. So let's meet at 7 p.m. We will have a rapid sorts of questions there. Till then, hasta la vista, das vidania. Thank you so much, dear friend. Bye bye. Thank you. Thank you. Bye bye. We will meet again, है ना? Restart at 7 p.m. Okay. If you have any question, any doubt, not only from this part but any part, feel free to ask it. Okay. Bye bye. Hasta la vista, dear Gaurav. Thank you so much. Bye bye. है ना? Thank you. Bye 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 bye. I am literally going away. We close.